Today I'm joined by the Secretary of Health, Kim Malzum-Risden. I'm also joined by Dr. Josh Clayton, our South Dakota State epidemiologist. We have 3 doctors with us from our healthcare systems that'll be joining us by video. Dr. Brad Archer, who's the Chief Medical Officer at Monument Health, Dr. David Basel, Pediatrics and Internal Medicine at Avera, and Dr. Allison Suttle, who is the Chief Medical Officer at Sanford Health. I want to give you a quick update on Smithfield and where we're at in the Sioux Falls area. We've continued to have conversations with our federal officials, with the U.S. Secretary of Agriculture, Sonny Perdue. He's been working with us. I've been visiting with Ken, the CEO of Smithfield, working on a plan to safely reopen the plant and get it back online to bring some relief not only to our ag producers, but to make sure that we're continuing to secure our nation's food supply. The CDC officials that have come in to help us with that are on the ground in Sioux Falls. They will tour the plant tomorrow and do that in partnership with state and local officials. And we're working really closely together and efficiently to make sure that we can get this done as soon as possible, but also making sure we're making the best decisions for public health. I want to talk a little bit about the employees that work at Smithfield and those that have tested positive for COVID-19. We are doing targeted testing in this area, which means we are aggressively testing these folks and who they've been in contact with. And we are using our contact tracing mechanisms and methods to make sure that we're communicating with them and as soon as possible and getting them into isolation and protecting their families and their communities as well. We have some challenges in the communication department just because of the diversity of the workforce, but I'm so appreciative of all the local efforts and groups that are on the ground there, and interpreters and specialists that are helping us work with that community to make sure they have all the information that they need and that we can help them as much as possible through this situation. One thing that would be helpful is if the public would continue to utilize the Care19 app. This is a phone that's for your iPhone. By the end of this week, it'll be available for Android phones as well, but it's called Care19. What happens when we do contact tracing right now is that when someone tests positive for COVID-19, Department of Health officials call them, the staff calls them, talks to them, finds out where they have been in the past week, who they have encountered, every name that of a person they've talked to and have been in close contact with, and places that they have visited, and then they reach out to those contacts, notify them, interview them, find out who they've talked to, and it takes hours and hours of time. This Care19 app will streamline that process greatly. If you will download that app, every single person in South Dakota that has a cell phone, and turn on the location services on it, it will track your movements for you and historically record it for you on your phone so that in the future, if you do test positive for the virus, we can immediately look at the app and you have all the information that we need, and in the future potentially notify other people that you may have been in contact with in a matter of seconds. What is taking us hours today, which we are doing, and we've greatly increased the staff doing this work, but that could be done in a much more efficient manner if folks would please download the Care19 app and utilize that to record that historical data. It is voluntary. It'll be utilized during this situation, and then the information will all be destroyed when we are done with this pandemic that's happening to our state and our country right now. I wanted to give you a quick update on the Abbott ID machines. You probably heard a little bit about these in the national media, also local media, and then I've mentioned them a few times in our press conferences. We did get a shipment of these machines and the equipment that's necessary and some testing supplies. These are pretty quick results, and they'll be very helpful for us in areas with vulnerable population or in hot spots such as what we're seeing in Sioux Falls. And we're very grateful that we do have supplies now to run those machines and to make sure that we can send them out to strategic and select populations where they'll be the most effective. I wanted to have Kim speak a little bit to how we will deploy those Abbott ID machines to make sure that they're utilized in the best manner.
Thank you, Governor. We are really excited to be able to deploy 9 different machines to 8 sites across the state. With the supplies that we have on hand. We do have additional machines. We're actively seeking more testing supplies so that those additional machines can be deployed as well. But today we will be shipping out the Abbott ID testing machines to Prairie Lakes Hospital in Watertown, Community Memorial Hospital in Redfield, the Huron Regional Medical Center. We'll be shipping 2 Abbott ID machines to the city of Sioux Falls, 1 machine to the Mobridge Hospital, 1 to the hospital in Martin, which is Bennett County Hospital, 1 machine to the Fall River Hospital in Hot Springs, and 1 machine to Spearfish, which is a Monument Health facility. All told, we will be deploying testing supplies for an additional 720 tests, and the folks that will be getting these machines will be working to get additional testing supplies, but this really helps us get more testing out there. We know that the more testing we can do, we can identify people that are positive, help them quarantine, keep them safe at home if possible, and continue our COVID-19 response. So looking forward to the deployment of the additional machines, but this is good news for South Dakota.
Great. Thank you, Kim. And I did make a request to the Vice President and the Secretary of Agriculture to help us with more supplies for those machines. But this will be great to get those deployed to these areas with some supplies so they can get up and running. And those are very quick results. Within minutes, we should be able to have the results, and Kim and Josh can answer any questions that you may have specifically about that type of testing that will be available throughout the state of South Dakota. Now, we wanted to talk a little bit about modeling, and I want you to remember that modeling is projections. And it is based on several of the national models that we've incorporated into how we've predicted what will happen in the state of South Dakota. And every single day that we get under our belt, we get more data and information that we can plug into those models that impacts it and what will happen for informing us on decisions that we need to make across the state of South Dakota. Remember, I've told you all along that I'm going to be making every decision on the facts and the data that we have in front of us and understanding the science of this virus and how it spreads. We're going to continue to recommend all of our mitigation efforts, but the data is showing us that we are bending our curve. What you are doing at home by staying home and by making sure that you're practicing social distancing is making a difference. The projections are more informed. As we watch how the virus has spread in different counties, how it has not spread in some counties, and how we've had a hot spot like Smithfield and Sioux Falls, we now know that some of these peak dates are changing. It looks like the peak in Sioux Falls in that area will likely be in the middle of May. That is a couple of weeks quicker than originally we had predicted for the Sioux Falls area. Again, we remember that the state would peak in mid-June. That date is changing as well. My team spoke with the mayor this morning of Sioux Falls and informed him on what it looks like for a peak and the time frame for the city of Sioux Falls. And that expected surge is expected to be approximately 1,200 to 1,300 beds. All of these projections and models inform us on how we need to surge up in our healthcare facilities to make sure we're taking care of people that need hospitalization or advanced care. So for the Sioux Falls region, when they hit their peak infection rate and their peak need for hospital beds, will be about 1,200 to 1,300 beds for that area. We believe that that capacity is already in those healthcare systems, although we are not changing how we're planning based on what we gave to you 2 weeks ago. Models are dynamic. They will continue to change. And this is a virus. It is fluid, but we have cut our peak, and that's a good thing. And it is encouraging to all of us. And we know that our healthcare systems can handle what is coming at us, although I have directed them and us and my team to continue to overplan and overprepare so that we can take whatever is coming at us in the future. I really want to thank Avera, and I really want to thank Monument and Sanford Health for joining us again and for helping with all of this. They have been incredible partners. I don't think there's any other state in this country that has had healthcare partners like we've had. They haven't cared who got the credit. They didn't care who was putting in extra hours or work. They all just committed to be a team to make the best decisions for this state and the people who live here, and I'm just so proud of them. I'm also proud of them for being willing to undertake a clinical trial in therapeutics like I announced just recently for using hydroxy to help the folks that are struggling with this virus and to help them heal. I just think that what they have done and gone above and beyond to be examples to this country of what's possible when you work together It's been inspiring to me personally. Now, before I turn to Josh, who's going to walk you through the current projections of what we're seeing, I want to reiterate that the numbers look better. It looks like we're going to need less hospital beds. It looks like we will need less ventilators in the state. But I am going to continue to ask that we all stay on the same path that we've been on for the last 2 weeks. I'm still going to plan on needing 5,000 hospital beds like I originally told you. I'm still going to plan for having 1,300 vents in the state of South Dakota because I want us to have all the capacity in the world to take care of individuals and to be over-prepared. Even though these numbers we're going to show you today are encouraging and look better for our state, we need to stay the course. All of this hinges on you doing your part, you taking the personal responsibility to continue to stay at home. If you don't feel good, you call your doctor. Continue to wash your hands. Remember when you wash your hands to use soap. That makes a world of difference to use soap for 20 seconds and continue to do that. Use good hygiene and make sure that if you're experiencing symptoms that you take immediate action. I'm going to turn to Josh, let him walk through a few slides with you, and then we're going to hear from the doctors that have joined us by video conference today.
Thank you, Governor, and thank you to our partners at Avera, Monument, and Sanford Health. It really is a great partnership to be able to be presenting these numbers, updated projections for you today. So I think many of you are familiar with the models that we've been showing you, and I do want to walk through what we have for you today. So in the red peak that we were showing, that was the anticipated peak based on no action being taken on the part of community mitigation, individuals social distancing and taking those precautions that are really needed for preventing COVID-19 transmission within our workplaces, within our homes, and within the community. That red peak is based on having our first case on March 10th, and we see that we have over 10,000 hospital beds needed at that peak. The other peak that you're familiar with is the blue peak, which was showing our initial projections as of April 3rd, which is needing about 5,000 total beds in the state at our peak need, and 1,300 ventilators. That information was based on about a 5% hospitalization rate. And the green peak, which is our new projection for today, is showing that overall what we're seeing based out of information that's been collected nationally, as well as information from New York and their experience there. Really want to thank them for sharing the data that they have to be able to help inform the models that we have both here, the models with our health partners, as well as other projections in other states. The peak for our anticipated peak, I should say, in the green shows about 2,500 hospitalization beds or hospital beds needed at our peak. So that would have roughly about 650 ventilators that would be needed. The focus here, I do want to just make sure that folks are recognizing that even though we're seeing that overall we're having this potential decrease due to the information that we're receiving on the ground from our partners that are experiencing COVID-19 widespread transmission within their jurisdictions, that we are really focusing on that planning for the worst case scenario, the 5,000 total beds, the 1,300 ventilators, and that's out of that perspective of would rather be prepared to meet the COVID-19 threat that is before us. Just wanted to again thank our partners for continuing our ongoing discussions related to our modeling and for helping inform those models.
Thank you, Dr. Clayton. And I want to reiterate, when you look at that chart that's up in front of you, according to that chart and the data and the models that we used that are nationwide, well-respected models that we plugged into that initial plan, we would have been peaking with about 10,000 people in the hospital about a week from now that would have been infected with the virus and needed health care had we done nothing. We did put in efforts and put in mitigation measures that made a big difference. And 2 weeks ago, we announced a plan to you to continue those efforts throughout this virus spread and cut our hospital beds down to 5,000 necessary at our peak. What we showed you today is we have again cut that peak in half. That is really good news for our state. That means that what you have been doing by staying home, by changing the way you do grocery shopping, by not having large groups gather together, keeping them under 10, allowing our businesses to be innovative, take care of their employees, but also still provide for their customers' needs, has been working. But we've cut our peak again with what our need will be for hospital beds, and we are looking forward to being able to get through this virus, taking care of each other in a way that I think is going to make sure that we do it the best that we possibly can. Now, again, I want to remind you all that we have to continue our efforts, and we have to keep doing what you've been doing for the last several weeks, and that we're still going to plan for that original plan that I announced a couple of weeks ago of having 5,000 beds ready and raring to go when they're necessary. But I do want you to know that it is encouraging and what you're doing is working, and it's been extremely helpful for those in your community that you're impacting. I do want to go to our physicians that are with us today to have them give a statement on all their work that they put into this as well. When you get to covid.sd.gov, the website, there'll be many more slides there, a lot more information on what went into these projections. So if you have questions about that, all that information is on the website at covid.sd.gov. So please go and refer to it. It is there for you to understand how we came up with these projections. But let's go to Dr. Allison Settle first. She will speak on behalf of Sanford Health and give you a quick update on their work and their projections and belief in this plan that we have for the state.
Thank you, Governor, and thank you, Secretary Kim Malson-Risden and Dr. Josh Clayton. It really has been a collaborative effort. I've been proud to have my team be a part of it, and it is very reassuring to see a more realistic picture based on some of the data that's come from New York. As Dr. Clayton said, Sanford is ready. We've been preparing for that kind of more significant or worst case scenario, if you will, and we'll continue to make sure that we have what we need to be able to take care of more if that need should arise. But I think because of all the really good social distancing that's been going on and how great everyone's been with complying with that and keeping each other safe, we've successfully flattened the curve, and we are seeing a more realistic picture that is doable. The virus is still coming, and I think that's the hardest part, is that we're still in this, and we will still have to get through that peak, even though it is significantly lower. But then we'll get to the other side, and we can start thinking about what does life look like a month from now and 2 months from now, and when can we, what will it look like there? So I think one of the biggest steps for that is really the ability to do testing. So it's great news to hear that there's been more testing available across the state. That's going to make a huge difference for South Dakotans. So thank you for that. And really thank you to everyone in South Dakota for all you're doing to keep each other safe.
That's great. Thank you, Dr. Settle. I appreciate that. Let's go to Dr. Brad Archer, who is with us today, and he's here with Monument Health.
Thank you, Governor. We really appreciate the ongoing collaboration, spirit of cooperation between Sanford, Avera, and the State Department of Health in confronting this crisis. It's no surprise to our analytics team that the output of the model changes over time as new information is received. And as the governor said, it's important to continue to point out that these tools are not capable of producing exact numbers or dates. They won't predict the next hotspot or outbreak, but rather these are approximations based on the latest information. And as such, we find the model most useful in informing our hospital capacity planning. We also find the model useful in our discussions with our elected officials as they consider strategies to limit the spread in our communities. Because of steps taken in our region, as was pointed out earlier, the model shows a very significant reduction in expected cases. And I'd like to express my gratitude today to the leaders and the people in our communities for their sacrifices in making this happen. We know it's not easy, and we much appreciate those efforts. And as Dr. Suttle stated, we would encourage you to continue with those efforts in an effort to maintain our availability of hospital beds and specifically ventilators and critical care for the folks that need that in the future. Thank you.
Thank you, Dr. Archer. I appreciate you being available today. Let's go to Dr. David Basel, who is the Pediatrics and Internal Medicine Doc at Avera.
Thank you, Governor. I would agree. It is amazing how big of a difference we've been able to make in this state through our efforts of social distancing. When we were first talking about these models a couple weeks ago, we pointed out the fact we don't have a vaccine for this virus. We don't have an antiviral for this virus. What we do have is each and every one of us, ourselves, our neighbors, our businesses. And that was going to make the difference on whether we were able to handle this surge when it came or not. And as we've looked at this data, we are starting to bend that curve in a significant fashion. We are reducing the number of hospitalizations and the number of ICU beds to something that we have a shot at being able to handle with our current capacities. It's still going to stretch us as a healthcare system to the utmost, but now we have a fighting chance so much better than we did the first time. Everything that we do, to stay home, not go out, especially if we have any symptoms or any hint that we may be sick at all. When you do go out, wear a cloth face mask, keep the 6 feet away from each other, wash your hands, all of these things that we keep hitting over and over again, which are our ability to fight this virus from spreading, are having an effect. And the more we do them, the models are very clear and very pronounced on how big of an effect that is. Just a small change going from one individual who's infected giving it to 2 or 2.5 people to that same individual giving it to 1.5 or 2 people makes all the difference in the world on where that peak hospital census is. I'd also like to express my appreciation to the governor, to the secretary, Dr. Clayton, Sanford, and Monument. I agree, there is no state like us out there where we've been able to come together, have transparent, open, collegial conversations that are practical and really make a difference in this state. And it's just such a wonderful experience to be able to work in that environment. Sometimes we're fierce competitors, but when a crisis comes, we're all in this together and we speak with one voice, and that is just wonderful. So thank you.
Thank you, Dr. Basel. I appreciate you being here as well today through video conference, and to all of our doctors for making themselves available. We appreciate your hard work, your systems, your teams that are out there every single day caring for people across the state of South Dakota, and your commitment to continue to do that throughout this pandemic and the virus spread through the state of South Dakota. We just know from the bottom of our hearts how much we appreciate you, and will do anything to help make your jobs easier as we do the coming weeks. Let's go to questions, but before we do, I just want to reiterate that we have encouraging news today. Our projections look better. Less people will have a need for hospitalizations than we originally thought. We'll have a need for less vents, but we are still over-preparing, over-planning, and we're still asking every single person in the state of South Dakota to stay committed to the plan of action that you have been on for the last several weeks. We absolutely have to continue these mitigation efforts to make sure that we are successful coming through this virus in a way that's responsible and takes care of our vulnerable populations and also those that we love in our homes and our families, and can come out and be stronger on the other side. And can I just take a personal moment to thank Julie, who has been here every single time that I've been here. I think she's the only person that's been here every single time except for the secretary maybe. But she provides an incredible service to people in the state of South Dakota, and we have given her at times 12 hours of notice. Sometimes we've given her a half-hour notice. Sometimes we've literally given her 12 minutes of notice that we are going to do a press conference because of the changing dynamics of what we're dealing with. She has had a smile on her face. She has been here to serve, and she is a gem. So I'm going to recognize her in a special way on Facebook this weekend. So she'll have to tune in. She's not going to be with me, but I'm going to talk about her a little bit. But I just want you to know how much I appreciate her and her being flexible. And she is really here to serve South Dakotans and make sure they get the best information, that everybody is as well informed as they possibly can be to fight off this virus. With that, let's open it up for questions.
Governor, this is Jackie with SDPP.
Yes, go ahead, Jackie.
I'm wondering if you can discuss how your team decided where to send the different supplies for the Abbott rapid testing.
Thank you, Jackie. This is Kim Malsom-Reisen. We focused on areas of the state where the hospital system does not have ready access to some of the more commercial lab capacity that we do already have in the state. We also wanted to make sure that some of our communities that have been hardest hit by this have the testing capacity needed moving forward. So that's why we focused on Huron in particular, as well as getting those 2 machines out to the city of Sioux Falls. And we also wanted to really look at West River and some of the independent hospitals in our West River locations to ensure that folks across the river have access as well.
Yes.
How many tests? Sorry, thank you. How many tests are you able to perform? Two-parter. And then, do you have plans for? Sioux Falls will be under control. You will get it under control. I have faith. But once that is done, will you then redeploy other systems that aren't in hotspots to? Are they going to try to test everybody? I realize that is not the case now, and it's not going, and there's not enough. But and I tried to contact the company to see what they were doing, and other reports they only got a few uses per thing. What is going forward?
Sure. So I want to just clarify that these machines will remain the property of the state of South Dakota. And so as we have differing needs in communities, we have the opportunity to redeploy machines to where they're most needed. And so we will continue to monitor the use of these particular machines. With the supplies that we got with this order and with our aggressive procurement of supplies, we're able to deploy between 72 and 96 tests with each of the machines. We'll continue to support the efforts of these locations in terms of, they'll need to continue to get testing supplies to keep them active, and we'll help them any way we can do that. But that problem is not going to go away. As soon as we're able to deploy or to get additional supplies at the state level, we will have more machines to deploy as well. But they've got to have the supplies to go with them, so that's what's holding those up.
Ask the company, and they
Governor?
Yep. So there's a couple of different ways. The state is able to request through a federal procurement site for these testing supplies, and that's what we will continue to use. We also can go straight to Abbott for the supplies, and that's what these sites will need to do in the future.
So
Correct. Yes, that's right.
Machines have a different supply need than other testing mechanisms. It's unique to that machine. Originally, we had difficulty getting the machines. There was some in some IHS facilities in the state and spread out, but we also needed more machines. We did get those from the federal government. Now we will consistently be asking for the supplies to keep them running. And I was on a phone call last night with many of the governors in the state, another one, or in the country, and another one at noon today. They're all struggling with supplies for these machines, but production is being ramped up, and so I expect that it'll become much more consistent in the coming days. There was a question on the phone line that someone was trying to ask.
Governor, that would have been me.
Okay, go ahead.
Red River Farm Radio Network. Sorry
Yes.
to interrupt. It's
No.
kind of hard to hear when you're on the phone if there are questions being asked on in person or not. So thank you for taking my question. I wanted to follow up with something I'd asked you earlier on this week, Governor, about the status of your work with Smithfield Foods to get the Sioux Falls pork plant reopened. I saw where Ag Secretary Sonny Perdue tweeted this afternoon that he was working closely with you. I wondered if you could outline some of the steps forward that you all are working on.
Yes, Sonny and I have been working on this ever since this past weekend, and the CDC team that is doing an evaluation and walkthrough of the plant is on the ground in Sioux Falls now. They will continue to do their work tomorrow in Sioux Falls and go through the plant with state and local officials, and then give us a checklist of things that need to be accomplished before it can come back up to full production. So Smithfield is engaged and working with us. Also, the Vice President has been involved. They all recognize that this plant is incredibly important to our food supply in this country. This is a national security issue that this plant run. It is defined and categorized as a critical infrastructure. Whether this virus impacts Sioux Falls, South Dakota, or the country, this plant runs. And so we need to make sure that we get it set up so it'll protect the health of the employees that are there, and also make sure that it's still doing what it does best, and that's continue to put out product that feeds our families in this country. We do believe at this time we do have increased cases, but we do believe that when this plant gets up and running, that it'll be a perfectly safe environment for these employees. There may be other things to mitigate outside of the plant, but inside the plant we're making sure that it is running and that the employees are in a position to where they have no concerns for contracting the virus.
Governor, I understand tonight you'll be talking on South Dakota Public TV in a town hall format. Could you give us a little bit of preempt to that? And I understand economic recovery and how we begin the rollout will be part of that discussion. Could you just briefly discuss that ahead of time?
Yeah, I think that's a great thing to mention here today is that tonight we'll be doing an hour-long town hall on South Dakota Public Broadcasting, but I think South Dakota Public Broadcasting has agreed to share the footage and the video stream with all the networks in the state, and I will be there answering questions, as well as the Secretary of Health, Kim Malzum-Risden, will be there answering public health questions, and then we have Commissioner of Economic Development, Steve Westra, will be a part of that town hall as well. I know we're getting a ton of questions from small businesses, small towns that are struggling, employees wondering when they can go back to work, what we're going to do as a state to help facilitate some of that growth when we get through this virus. And I would encourage you all to tune in. It's going to be a free-flowing conversation and answer to questions that South Dakota Public Broadcasting has been taking from viewers and from other people throughout the state. And I believe it starts at 7. Yeah, 7. So sorry, my day is full of things that are on the calendar. So it'll start at 7 o'clock Central Time tonight and go for a full hour.
And just to follow up, if I could.
Let's have a follow-up, and then we'll take this other question in the room.
If we could, just are there plans now being underway for the economic rollout? We've heard a lot of that in the national media. What's happening in South Dakota? There
is plans being made to make sure that our economy has the best opportunity to come back as quickly as possible here in South Dakota. We talk about it every day in conjunction with dealing with the public health threat that we have, but it's going to be a challenge. We have seen whole industries in our state completely devastated and wiped out. Our hospitality industry, which largely deals with tourism, went from 100% bookings at most of our hotels and restaurants in those areas to almost nothing. So we are doing what we can. We have a Governor Noem's disaster loan program that we've stood up at the state level to help some of those small businesses get through this difficult time and pay their light bill and make sure that they can not go bankrupt in the next couple of months. We're going to patch them through, but then we're also going to make sure that when we come out on the other side of this, that we get them back up and rolling and get their employees back to work and taking care of their families. Belle, let's go with you.
Updated infection numbers from Smithfield, because yesterday I think you gave us 438 and 107. You have those updated?
Sure. So in the report that we gave today, we currently have 518 Smithfield employees who have tested positive, and we have 126 contacts of Smithfield employees who have tested positive.
Okay. And you also mentioned that the peak for Sioux Falls was now in mid-May, and you said you were going to tell us what it was for the state.
It still continues
Sure.
to be.
So
it's
the
still
peak, the peak for the state remains the same as the prior projection, which is mid-June. So Sioux Falls is peaking a bit earlier.
Okay, and then just one other question. Of the 51, you have 51 listed on the website as having been ever hospitalized. Of those, can you tell us how many have been on ventilators?
Not accurately, probably.
So we do have a number of individuals that, in addition to being hospitalized, have been on the ventilator. I believe the conservative number would be 4 at this time, but that is something that we continue to monitor.
Governor JP at KORN News Radio.
Yeah, hi JP.
Got a question. Now that the clinical trial is underway at Sanford, do we have any numbers on how many people are in it thus far?
No, I don't have confirmed numbers. The people are getting the drug as a therapeutic today. This week, Sanford is continuing to run the official federal protocols that are necessary to start up the clinical trial, and we think by the end of next week they'll have all those boxes checked and the actual trial will begin. But because the drugs were delivered last weekend in such a short amount of time since we had requested them, they are available and patients are utilizing them that we think could be beneficial. But the actual clinical trial here will begin in a matter of days as soon as we get those confirmations and certifications from the federal government.
Thank you.
And I want to remind everybody in the state as well that while Sanford Health is taking the lead in this clinical trial, that Avera and Monument are all participating. That's what makes this such a special thing, an example of what South Dakota can do, is that all 3 health systems are participating in utilizing hydroxy to treat patients and in the drug trials so that it can be a comprehensive statewide drug trial that is unlike anything that's ever been conducted before in this country. It is also something that will impact a lot of people, up to 100,000 people in the state, which is a wide number that will give us better results. Let's go to the next question on the phone.
Hi, this is Morgan from the Journal. Sorry.
Yep, go ahead, Morgan.
There. I have 2 questions. First, is the State Department of Health any closer to releasing data about a positive or negative testing breakdown by county?
Thank you, Morgan, for that question. We are getting closer. I'm very hopeful that we will be seeing that level of breakdown in a matter of days. And again, we will continue to refine the data that we're able to provide to be as helpful as possible.
Okay, and then second question for the governor. I just want to clarify that I think you said that Sioux Falls currently has enough capacity to deal with the peak in mid-May, but I just want to also just get an update on the National Guard building any hospital capacity there, and in Rapid City, is there any update on that today?
Yes, we are still building out that capacity, utilizing our National Guard, putting in hospital beds in the Sioux Falls area and in the Rapid City area. So we are sticking to our original plan of making sure that we will have 5,000 beds available at our peak infection time, ready and willing to serve people in the state that may potentially need it. Even though all of our projections show that we've cut that need in half, we're still going to stick to our original plan of preparation.
Do we know where that'll go and when it'll be set up yet, or is that something to be determined?
We will be able to share with you what facilities will be utilized for that in the coming days. The reason that we don't have it today is because they're working with the Corps of Engineers and their guidance and their protocols of what needs to be in a facility to set up something like this. And so they're just about completed with that analyzation and will be ready to start doing setup as soon as the Army Corps and National Guard come together on that plan.
Okay, thanks.
Now that the CDC and y'all have made, and it's on the website, so it's for real, everybody should be wearing a cloth mask. Mm-hmm. If you drive around, at least in Pierre, not a lot of, there are some, yes, there are some, and not a lot, but like if you hang out at Dakota Mart for an hour or Walmart, you really don't see that many. Do you hope to see, do you expect to see, do you think that folks are going to
You want to speak to that?
Sure. So the question was around the use of cloth masks for the general public, and so that was a change from the CDC. So that's recent. But I would just emphasize that that's a recommendation from them. It's not necessarily a directive, and so people just need to use good judgment. A cloth mask is no substitute for good social distancing, and so people really have to stay away from other folks as much as possible. Limit the times that you just have to enter your community. We've heard great suggestions from healthcare providers to do really practical things like don't go to Walmart every other day. Try to go once a week. That's just going to naturally minimize your exposure. But there's very practical solutions that people can take. And if they are concerned and want to mask, they can certainly do that. And they should use cloth masks, not masks that are intended for the healthcare community.
Governor, this is Amy Furlity from the Associated Press. This may be a little premature, but do we have any results from what the CDC found at the Smithfield plant yet, or any recommendations at this point?
We do not. They don't actually walk through the plant until tomorrow, and they're doing that with state leaders, Department of Health, and local leaders as well. So we will keep you updated, and I'm sure Smithfield will continue to stay engaged to make sure that we're letting you know where we are on that progress. Any further questions on the phone? Okay, in the room? Okay, we will talk soon. Thank you very much.